Okay, so now I'm here to the final portion of my skill, and that's to discontinue the IV. The physician has asked to discontinue the IV, so I check the physician's orders for accuracy. I tell the patient what I'm about to do and why. I look at the site, check for infiltration, phlebitis, any type of problem. I remove the tape. Okay. And I loosen the turbidor, going to the center. This is a little bit sticky, so I'll have to go into the center of it. Okay, loosen, going to the center. Good, it's all loose. All right, I get my 2x2. Okay, I get my 2x2. I get my gloves on because I'm going to be pulling this out. There's a chance of blood contamination, so I get my gloves on, and I'm going to remove the turbidum while I'm stabilizing the IV site here. So alright, so I would stabilize. I'm going to use this hand so the camera can see what I'm doing, and I would just remove. Okay. Ooh, sticky. Sticky, sticky, sticky. Right. Okay. Now I'm going to take my 2x2, and I'm going to just place it right here loosely. And then I'm getting ready to just swiftly remove the IV. I'm not putting any pressure, I'm just holding it. So I will just swiftly pull it out, and then I put pressure on. So otherwise there'll be lots of blood if I don't do that. So when I take out the IV, I have to check the cannula and see whether it's intact, if it's, what sort of condition it's in, if it's not broken or anything, and it's intact, so I know that the whole thing came out. Okay, so I would put that away in the shop's container and keep holding on here. Okay. Okay. If the patient is on heparin or Coumadin, it will take a while for the bleeding to subside because the blood would be thinner. I'm going to put now a pressure dressing. So I will just fold my Band-Aid, and this is really sticky here, tricky here, I mean, and I'm going to put some tape. So I would start on one side with my tape. Okay, I need to do that so the camera can see what I'm doing. Okay, so I would start on one side with my tape like this, and I would stabilize this, and I would pull the tape onto the other side tight. Pull it to the other side tight, and I would just take off this part. Okay, and stabilize it nicely. Make sure it's nice and it's all together. So there, I've done it. I have removed the IV, and it's intact. The cannula is intact, and I have put a pressure dressing on. So now I would just wash my hand, go out and chart. Chart the size of the gauge, the condition of the site, what IV fluid was discontinued, and I would come back in a few minutes and check on the patient, make sure the patient is fine, and if all is fine, then that would be it. And this concludes my skill. Thank you.